it boils down to even who you're voting for. Because, there's politics around everything. Road, nitakufungulia hospitali, nita-ensure sijui nini, wamama watazaa. And it's like, come on, you clearly don't even understand what's going on. And this is the reason why we vote for these people. So you've been invited here today to help us understand. So that when we're going to the ballot, or when we're talking to our politicians, we know exactly what we're telling them. Excuse me, wacha panganga, enda waambie this. So, before we took the break, or before we switched on the microphones, there's something you said about the number of people who become poor every year because of healthcare bills.
1.5 million people become poor every year. In Kenya alone, I'm not talking about Africa or globally. In Kenya alone, become poor because of healthcare bills. And this is how it happens. You are working, on average, an average Kenyan in the rural community or wherever they are will work 5 to 8 jobs to make a living. Okay? They're selling chicken, they're shoeshine, they're selling newspapers, they're doing this and that. And alongside that, that's kind of the family. The wife is doing this and that. If one person gets sick, the entire income structure collapses. Because maybe one person was doing 3 jobs, those disappear because they're now in the hospital. Then the other person now has to stop working to start visiting them in hospital, and there's no income, and therefore now they start to rely on the social structure. Harambe, please send me, my wife is sick, my husband is sick, my daughter, my child. And at the end of the day, their income stops and they are poor. We are one sickness away from poverty. Ideally, in a civilized society, nobody should ever have to worry about where the money comes from when they're sick. Nobody should ever have to worry about that. And that's what universal health coverage is about. That you build a system that actually works. It's not about excellence. It's not about having the same quality you have in a private hospital, in a public hospital. It's about outcome. It's about that when a mother is pregnant, you can have a healthy mother and a healthy baby at the end of the delivery. How you achieve that doesn't mean that you have expensive equipment. Basic quality healthcare. Then you ask yourself, how do we make sure we protect the people from having to worry about how to pay for it when they're sick? Because almost 30% of people don't seek care even when they're sick because they fear, how do I do that? And you have to worry about transport, you have to worry about this. So health is the most important investment a government can make. But you know what the challenge is? The challenge is that some of the health interventions require long-term investment. Politicians are thinking in 5 years. And they're thinking in 5 years, as I go back for votes, what will I show the people? Therefore, I'm going to build a big hospital, which has no doctors, no medicine, nothing. It is basically a form of a substance. So the people must take charge of healthcare. That's the only. Politicians will not deliver healthcare. The people must understand and start to actually make political choices based on health investments and education investments. Those are the 2 most important things we can do for any country.
Doc, you've mentioned that any Kenyan should be able to go to the hospital and not worry about how they're going to pay for this.
Yes.
Most of us, what you've just said is foreign. It sounds like something maybe for Wazungu, in a first world country.
Exactly.
We've never experienced anything like that. We have just slowly come from, forgetting about, dawa, it's called what, your traditional herbs. Because anytime you think of going to a hospital, bills.
And the issue is, you see, in Kenya, if you look at, if you go to a dispensary, if you go to a health center, those places are free. They have been free from 2012. But when you go there, you are told, okay, I've checked you. You don't have to pay anything. But here's a prescription. Go to the pharmacy and buy
medicine.
That's a challenge. So if you have a problem, first, you can't get a diagnostic equipment. So even if you're developing cancer, maybe this was causing the pain, you need early diagnosis. I don't know that you know that 80% of all the people with cancer go to the hospital when they're in stage 3, 4. Okay? So, and maybe they were seen. They have actually been in the facility many times, but they never got diagnosed. But because they don't have money, they're told, you go do this test. Then you go to the lab, you're told, this thing is 3,000. Then you're like, hey, wacha kwanza niende nilime, then I will probably get some money and come and pay. In the process, the cancer is getting worse. So you must remove point of service costs. That's the convention around UHC. You must remove the pay at the point of service. So then people can seek health care.
All right, let's talk about funding, because, there's NHIF that has been brought in the, which is supposed to be helping. But let's not talk about NHIF. Let's use Ghana as an example. Ghana is one of those countries that has, universal health coverage for all, guys. An African country that actually has decided UHC is the way to go. There are about 9 African countries that are on that team. So because the conversation is this something we can sustain, or is this just a political promise that we need to look at? 50 years is what it will take for us to be able to attain it. When you look at Ghana, they've dealt with the basics. One being insurance schemes that work. The NHIF that actually covers everyone. We have NHIF. What are the challenges?
The challenges are that I have talked about this, that the issue is the base of the pyramid. It's the poor people that we must first worry about. Okay? Now, if you have NHIF that focuses on the private sector, you're not getting anywhere. All right? What Ghana did is say, we are going to start a social insurance scheme. Let's not even NHIF, whatever. It's a social insurance scheme that starts with the poor. So they took their VAT, added a little of it, and put that money into healthcare, and provided everyone with an insurance cover. So when you go to the hospital or you go to a facility, you actually have listed services you get. Just as soon as you show that card, you get services. This is also going on in Rwanda. Rwanda, about 90+% of their people have a card. You just walk in, you get care, and you go away. Now, the problem with our NHIF is that it has focused on private sector. It has started to participate in commercial schemes where it's competing with other private insurances. The only way to resolve NHIF is drop the commercial competition, convert NHIF, because it's a public facility, it's a public institution, convert it to social health insurance, which has 2 things: mandatory payments, which you and I pay. Then the government takes our taxes, identifies the poor people, and gives all of them, using our taxes, NHIF cards. Then you have 60-70% of people in NHIF. Then the rest of the people who are doing matatu business, they own butcheries, shops, and they can afford, they are then forced to actually contribute. You say, before you renew your butchery license, show us an NHIF. Then you're sorted. So the models exist, but the politics interfere.
Kenyans, Meskia, you can actually access healthcare, but politics is interfering with you getting to what you need. It's Dr. Githinji. He's the CEO of AMREF. We're going to come back. Whatever questions, we're going to open the phone lines at some point. But when we come back, we're going to talk about facilities.